Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by AACN's certification, offering specialty, subspecialty, or advanced practice board certification, with information available at www.aacn.org/get certification. Now, here are your hosts, AACN's Chief Clinical Officer, Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Hi, this is Vicki Good, and welcome to the Voices in Nursing podcast. I'm here today with my co-host, Andrea Schmidt, and our guests. And we have a true treat for our listeners today. Most of us care for numerous patients, but we rarely get to speak with them after our time together in the critical care unit. We are very honored today to welcome a former ICU patient, Tim Dorman, and his daughter, Abby Pledger, to our podcast today. So first, let's start our podcast with some brief introductions. Tim, would you and Abby give us a 1 to 2 minute introduction?
Sure will, Vicki. First of all, though, I want to say thank you to all of the critical care nurses around the world. And a few of your representatives kept me alive about a year ago. And my profound thanks and appreciation goes out to each and every one of you for what you do every day around the world. Now, as for me, I live with my wife in Sonoma Valley, about an hour north of San Francisco. We have the good fortune of having 3 children, all of whom are within an hour and a half of us, and in turn have children of their own. And Abby represents the next generation, and you'll have an opportunity to talk with her. I'm 77 years old. I'd like to think of myself in good physical shape. I had a very active life. And my career as a consultant and leadership coach. I've worked with both nonprofits and corporations, including a number of healthcare organizations over the years. So I have, I think, a good sort of inside snapshot into some of the challenges that you collectively have had, and it's been profoundly gratifying for me. And now I'm at age 77, mostly retired, trying to stay as active as I can and participate in a number of volunteer organizations in the area.
And Abby, will you introduce yourself?
Yes. So I am Tim's daughter, Abby. I am one of 3 of his children, the middle one. I have an older sister and a younger brother, who you'll hear a little bit more about as we go. I live in Northern California, just north of San Francisco in Marin County. So I'm about 45 minutes to an hour from my parents. I'm a mom of 2 kids. And I am also, in my free time, I'm a competitive swimmer, both in the open water, I swim in the San Francisco Bay, and in the pool. For work, I focus on strategy and transformation and helping organizations evolve and change and grow in the most effective way possible. And that is a little bit of a snapshot of who I am.
Much, Abby and Tim. I am Andrea Schmidt with AACN, and we're doing today's podcast as a result of the letter that your daughter Abby wrote to the Daisy Foundation to recognize the excellent care that you received while you were a patient in the cardiovascular ICU after a devastating heart attack. But that wasn't your first interaction with the Daisy Foundation. So how did that relationship actually begin?
It actually started on a bicycle ride. And I was on my way home, and about 3 houses away from parking my bike, and ran across this woman who was out in the yard, stopped and introduced myself as a new neighbor. And we started talking and really hit it off, and she yelled to her husband, "Mark, you've got to come out here. There's somebody I want you to meet." And so Mark Barnes came out and met Bonnie Barnes. And these are the 2 founders of the Daisy Foundation. And as you know, they started the Daisy Foundation as a memorial for their son, Patrick, who died early. And they were looking for a way to memorialize him in the most powerful way possible. In that process, they started the Daisy Foundation. Following that wonderful neighborly introduction, my wife and I simply became very dear friends of Bonnie and Mark Barnes. And we've had some wonderful, what I would call informal discussions around the future of the Daisy Foundation going forward, the challenges, the opportunities, and frequently nurtured by a wonderful glass of wine.
And that is so typical of Mark and Bonnie. Their genuineness just shines, radiates from both of them. And
Yeah.
I would say the nursing community is internally grateful for everything that they have done for nursing and to recognize nursing. But to focus a little bit on you, as you indicated in your introduction, you're no stranger to the medical community. In fact, your grandparents and your great-grandparents were both medical missionaries, which is absolutely amazing. And then you contracted polio as a child, and as a student, you served in the hospital in an orderly role. So you've done a lot in healthcare, even though you're not officially trained in healthcare. During your coaching and consulting business, you've helped healthcare leaders to really discover their purpose and leverage their strengths and work together in cohesive, dedicated teams. So how did those interactions really help you to prepare what would become the fight for your life?
Yeah, that was I think, a wonderful question that you posed to me in advance, so I could give it some good thought. Because there really are two answers that are sort of diametrically rubbing up against each other. And the first is that both my personal experience that I've had in and out of hospitals as a patient and on a professional basis, it has given me, I think, a real familiarity with both the overwhelming sense of purpose and passion that people in healthcare delivery bring to the table, but also in recognition of a lot of the challenges and sometimes conflict that exists in those high-stress environments. So in that regard, as I climbed into the ambulance just a little over a year ago, or I should say wheeled into the ambulance, there was a familiarity with where I was going and a confidence and a level of trust that I put in to the people that took care of me that was absolute. The second part of the question, Vicki, is there's nothing that prepares you for the fight of your life. And certainly that is equally true for Abby, as not just an advocate, but a daughter, and certainly true for my wife, Lori, and the rest of our family. And so there was a level of confidence with which I took a leap into the great unknown. And it was truly putting my hands and my life in the palms of all of you.
Wow. I think we often as nurses forget the preciousness of what we do. And just your last statement brings that to light. So Andrea, I'll turn it over to you for the next question.
Thank you, Vicki. Tim, I just wanted to say that we're grateful that you're here with us. And we'd like to just know a little bit more. And so I understand that your first heart scare occurred in 2014 while you were working with a group of healthcare executives in Boston, and you ended up with one stent being placed. And then 9 years later, August 31st of 2023, while you were recovering from multiple knee surgeries, you started experiencing more cardiac symptoms again. But you weren't the one who recognized what was happening. It was your wife. Can you tell us what you remember about what happened next?
Yes, it's a fairly short response, Andrea. My wife and I had gone to bed, and I forget exactly what time it was, but let's say it was 9:30, 10 o'clock, something like that. And to the best of my knowledge, I was feeling fine when I got in bed, and it's not as there were no sort of prior symptoms or tweaks during the day that somehow gave me pause and points of concern. It was just a normal night of preparing for bed. And then I remember sort of thrashing a little bit. And my wife, Lori, pretty remarkable and perceptive way, immediately asked if I was having a heart attack. And you can guess what my response probably would be. No, I'm sure I'm fine. Wrong answer. And she said, I'm calling 911. This is a woman who has been in project management and leading events of high stress throughout her life, and this was her platform to take charge. So in any event, she called the emergency responders right away, and we had the good fortune of being in relatively close proximity, and I would say they were at our house within 10 minutes. And had it been longer, I might have died. They took me into an ambulance. I'm sure there was some immediate triage that they gave me. I can't recall exactly what it was, but put me in the ambulance and took me to Providence Memorial Hospital in Santa Rosa, which is the acute care facility for cardiac patients in our area, about perhaps 25 minutes away. I can remember what I would call some high anxiety in terms of that trip, not pain necessarily, though that may have been there, but it was more a question of anxiety and what the future was going to bring. At which point I would probably turn it over to my daughter Abby for any additional insight or perceptions in terms of what happened. Actually, Andrea, the one thing I would say is that we were met at the hospital by another team of critical care nurses, and I think there may have been a doctor out there as well on the tarmac that met us upon arrival. And so speed and urgency and responsiveness and teamwork was ready to go. And I was the beneficiary of that.
So, Abby, it does sound like it was a blessing in how all of the events transpired, because sometimes we're not that lucky that somebody's there and recognizes. What do you recall from that night?
Sure. So if I could bring a little bit more color to what my dad shared, and a little bit of a deeper moment is my parents have been together since they were 14 and married as childhood sweethearts at 21. And they had celebrated their 55th wedding anniversary that weekend before, and our whole family was able to gather together. It's one of the benefits of us all being within 2 hours of each other. But we don't get together that often. We all have very busy lives, but we'd been together that weekend. And my dad has been coming off a series of very serious knee surgeries, and as a result had been non-weight bearing all summer. It's been a very challenging summer. We had all been there frequently helping my mom. And he'd been sleeping in the guest room because it had a bed that was easier to access. And when we all arrived for the weekend, he had moved back in with my mom. And the heart attack happened 4 nights later. And had he not moved back in with my mom, and had we not all been there celebrating their wedding anniversary, again, it would have been a very different outcome. So there was a number of interventions that, call it divine, call it what you want, but give you the chills when you really think about it. I had just flown back from New York City. I'd been traveling on business, and I was in an Uber at midnight on the 30th. And I get a call from my mom, which scared me immediately. It was what we call fire season in Northern California, and they live in fire country. And I assumed it was a fire. And my mom couldn't get a hold of my siblings. She was able to reach me, and she said, I think Dad's having a heart attack. The paramedics are coming. I can't reach your sister or brother. And so, that's a lot to process. It's a lot to process in the back of an Uber and a very human and real experience that, you're not necessarily in control when you're not the one driving. And, to speed up the story, I was able to get a hold of my siblings through this will make anyone with teenagers laugh. Through the teenagers, they were all awake. I was able to call my nephew, who then called my daughter. And so by the time I arrived at home, everybody knew because the teenagers had circulated among themselves. But I was able to get up to Sonoma, and my mom and my brother was too, who's close by within the hour. And, by the time I got there, they were readying to move him into a room, and the stents were already in place. So again, just moving with extreme speed. It was incredibly impressive at the hospital. And then they settled him in for the night. And that was a very, very hard night. And into the next day, lot of discomfort. They told us it was normal. It turns out it was not normal at all. And over the course of that night and the next day, it turns out he was in cardiac arrest again, and the stent had failed. And they ended up bringing him back to the cath lab, I believe the afternoon of the second day, and had to put 4 more stents in because it was a complete failure. And that was as you'd imagine, a very emotional experience. And what was supposed to be a short, go back in, ended up taking a very long time. And at that point was when they moved us into the ICU and really started that intensive care of my dad.
Your family was incredibly involved in your dad's care, basically staying by the bedside 24/7, with each of you taking turns staying there. And your father tells us that you were treated like family by the nursing team. What did that experience, what impact did that have on you as a patient's family? Because I think oftentimes as nurses, we forget about that impact to our patients' families.
Yeah, going into this, at the beginning, I didn't know what to expect. And when he was moved into the ICU, I guess I thought we would just have very short visiting hours. I didn't anticipate that it was going to be almost this holistic experience that we were all a part of. A friend of mine in the medical community had told me early on, one of the best things you can do is to have somebody there 24/7. And I think it was something our family was naturally gravitating to and realizing the value of and importance, but the hospital really welcomed it and the nurses really welcomed it. And I remember that first night, I think I was leaving and my brother was coming in, and, they helped us move the couch into a bed and open it up, and just not this feeling of like, we're going to tolerate you being here, but we're going to welcome you being here. And it felt like for that period of time that we were there with my dad in this intense situation, that we were one team. And I felt like the nurses in particular really treated us as one team. And, the doctors would come in and they only have so much time, right? And it's pretty technical. And the doctors would leave. We would obviously ask questions, but the doctors would leave and the nurses would help us translate and help us understand what was happening. And really, I felt like bringing us into that process. And in the process, we got to know them. And if I could just share something my brother wrote, which his name's Zach, which I thought was it captures it really beautifully. And he said, in the late moonless hours of the night or early mornings of the dawn, deep, soul-filling, thoughtful connections were made, filled with conversations about our relationship to you, conversations about their own loved ones and families far or near. Or it was really getting into the nitty-gritty of what the numbers, the instruments, the metrics, and the noises all mean and how they're connected to you, connected to your head and to your heart, to our heads and to our hearts. For me, these were the absolute moments of clarity in a sea of unknown. And even clearer was the single thread running through a fabric of people, shift to shift, working tirelessly, selflessly to create a sense of hospitality that cared for us day in and day out. And that's what they did for us. And it wasn't just for us.
I just would like to interrupt you for just 1 second. I'm crying.
It's hard to read it without crying.
I'm crying right now because this is the essence of critical care nursing.
It is. And the letter I wrote afterwards, which sparked this moment, I took so much away from that experience. And it was so meaningful to me, to our whole family, what we had gone through. And it wasn't just that our dad had suffered this major heart attack. It was the experience we had and how we were cared for and how values were lived. Both my dad and I spend a lot of energy in our professional lives on helping define values and how to live values in organizations. And it was like the most real experience you could have of how values are lived. And what I was going to add is that's what our family experienced, but what we also observed in the ICU, because you're all sort of in this extended moment of time together with other families, is there was a fireman that was in there, and his family was the firemen, and they would come in 2 by 2, and there would be 20 of them out in the hallway at any given time. And there was a family of rodeo guys, and they would come in through their cowboy hats, and there was an immigrant family. And I imagine all these families were treated like we were. We weren't different. It's just that that's how those values were lived.
Thank you so much for sharing that. It really sounds like the healthcare team just really was so available and on point in supporting the entire family during this time, because it can be so challenging and so frightening. And it just really sounds like they did an incredible job. And it's the essence of what nurses are and who we are and what we do. But we heard that during your dad's stay, the family created a Google Doc to share information between family members. Now, many hospitals may call that an ICU diary, but I really think it's a phenomenal way to share information. How do you feel like this document helped your family during this time?
There could be such a thing as best practices for families navigating this. I'd add that to the list. I was just looking through our Google Doc, and it's 44 pages long. This was I think a 12-day stay. And there was me and my 2 siblings, and then our spouses and my mom. And so those were all the people contributing. And it was really the thread that wove through our days, the visits, the material moments. And it was how we communicated with each other. And when you read it back, which is not a pleasant experience, but you see our personalities woven in, and even moments of humor, particularly as we started seeing some progress with my dad. Like, I was just reading a little nugget where my sister had titled the day Bed Bath & Beyond, or College Football Saturday, like some little bit of normalcy in there. But we used it for everything from the metrics of what we were seeing, on the screens, to the things we were learning. We were doing a lot of external research to educate ourselves. My brother jokes that he got his MD in cardio that month. Friends we were talking to that are in the medical industry, of things to know, and just everything went in there. And so we had something to reference back, or we could see strides he was making. And we weren't doing it to check up against the hospital team. We were doing it really for ourselves and our own communication, and how to keep us navigating as one, especially when, we were all trying to work and raise kids at the same time too. So if you didn't get to be in the hospital that day, you could go back and look at everything that was happening, and you didn't have to have 5 different phone conversations. So it was extremely effective.
Do you feel that this helped you stay positive throughout a very difficult course, as you could see the little glimmers of hope?
I think so. And it really helped, it's grounding in the facts. And obviously this is a very emotional thing to go through, but the data's the data. Yeah. And so you can see those improvements of those numbers, which just for a while just creep up little tiny, tiny bits, but that you have that hope to hang on to, and you can piece those bits together to larger bits of hope. And so, and we all would translate it in different ways, and needed to lift each other up. And so you can use that to lift each other up too.
I think that lifting each other up piece is very important. It's important for me to recognize and remember that the trauma for my family was greater than the trauma that I was experiencing on a psychological basis. For me, I don't think I really understood the gravity of my situation, and that I was, in our older daughter's terms, a razor's edge away from death. I didn't have a full grasp of that. But Abby did. and her brother did, and her sister did, and certainly my wife did. And to have something concrete that, and a very specific role that they could play in making a contribution towards my desired survival, I think was great, not just for me, but also for them.
Now, I think that is so critically important, Tim, because oftentimes as a nurse, you get so focused on your patient and you forget about the family that's surrounding them, and how much they're going through the exact same, if not more trauma than the patient themselves. I said I wasn't going to cry today, and definitely that the insights, the poem that your brother shared is phenomenal. And I would love to, somehow get that out to general public, because that is some beautiful words. You talked about in your Daisy letter, the fact that your dad was treated as an individual, a man with vibrant life. I think you've already alluded to this, but why was that so critically important to you and to your family?
I think when you go into the hospital, and I have not spent a lot of time in ICU. I consider that a gift that I've had that privilege, not in it professionally, and that I haven't done it personally until now. But, when you are in the ICU, you're hooked up to all the machines, and, you're really your worst, right? Like physically. And for somebody to be able to see you, that you are this person with this vibrant life that is generally a healthy person, and it makes you see them for who they want to be seen. And so I just felt like the team there did a really wonderful job of engaging with my dad as they would engage with him if he were a healthy person. Obviously, at all points, he wasn't completely there or able to completely absorb the information, but they gave him that opportunity and they spoke to him that way. And they gave him choices also where they could give him choices. Sometimes those choices were limited to, is it a chocolate pudding or a vanilla pudding, Tim? It may not have been about the care that you're about to receive, but giving him those choices. And when there weren't choices to give him, they were telling him what was going to happen next, what was happening now, their assessment of things. And I noticed that they always came in and talked to him. And we were in the room, but they would direct the doctors and the nurses, their conversation to him. And sometimes I'd be thinking, I know my mom was thinking this, like, he's not retaining this, and we're madly writing on our computer and our Google Docs. But just that simple act of who you're directing your eyes and your focus to, of you matter to me and I want to get you back out there. And it made me look at when I would walk down the hall of ICU, these other patients in there, and you're giving them their privacy, but they're there, of you too are this vibrant person that's trying to get back to your life. And that's your goal. And I imagine as a nurse, sometimes it's hard to see them outside of that bed, but I feel like the team did. And I really was grateful for that.
I think that's such an amazing component, that you recognized. And that is one of those soft skills that I think can be really challenging for people to either learn or embrace. And I think it's such an important message for all of our new nurses that are out there as to, what that looks like when you're providing care to a patient and treating the person as a person who, has a life, had a past life, has a family. I think it's so great that you recognize that and that they provided that for you. But you also wrote in your letter that you recognized really how grueling providing healthcare could be. But you wanted the team to know that the care they provided was changing lives, not just saving them. So I'm really curious, in what way do you feel that it changed lives?
I think these group of nurses, and I think all of you critical care nurses out there and those listening, because I think you all exhibit these behaviors, is leaders with compassion and seeing people as individuals and putting their whole selves into everything they do and infusing that into the people that they come across. I know this is one of the hardest jobs. I know going through COVID and coming out of COVID, like it's just, these are the teams that have been on the very front line. And I think what I want you all to know is how much you matter. And it's not just to the patients like my dad, but it's to all of us who come in contact with you. And if we could all take just a bit of that compassion into the rest of the world, we'd be in such a better place. And not to like overdo it, but I really think there's so much truth to it. And so it's just this huge gratitude that there's people out there that you, when you're at your very lowest or worst, are really going to care for you and do everything they can to get you back to the life that you want to lead.
That's really a wonderful insight. And I can tell you as a nurse, the part of the letter that, sort of struck a chord with me was really how that letter provided meaningful recognition for nursing. And although your family didn't get to directly present it, the Daisy Award, to your father's healthcare team, you were able to deliver a Daisy letter to another recipient. So I'm curious as what that experience was like for you and your family.
It's really interesting. It boils down to something profoundly simple, which is when you give people thanks, it feels good. And I think that too frequently, and probably particularly in critical care, nurses, to say nothing of the people who are changing the waste paper baskets and cleaning the bathrooms, they don't get thanked after the fact. The relationship ends fairly quickly, and people go about and pick up their lives if they can. And so it's being able to have the opportunity to come back and say thank you. And at Providence Memorial, it was meeting with all of the Daisy Award recipients at the hospital. And it was right around Thanksgiving. Just that simple act of thanks for them was extremely important. But it was really important for us too. It gave us an opportunity to participate in the gratefulness and to participate in the compassion that Abby was talking about, but also the passion that they bring. And I can't speak for the critical care community around the world, but I bet you that if you had to look at sort of core values, there's some combination of both passion and purpose for what they're doing, and an extra mile sense of compassion as well. These are the good Samaritans around the world that people like me need, and are so grateful that we had that support.
Well, as we start to close our time together, we just want to say thank you for, one, taking the time to share your story. Thank you for writing the Daisy letter. You do not know how much that means as a bedside nurse to receive that letter. Days, weeks later, after you've taken care of a patient, the impact it makes is absolutely incredible. Nurses, as you've indicated, we do hard work, but we do it because we love it and we want to take care of people and we want to make a difference in people's lives. But getting that thanks is sometimes more than our paycheck that we get for doing the job. So as we close our time together, I just want to give you the opportunity. What is the one thing you want to leave our audience with? So we'll start with you, Tim.
I want to leave you with one visual, because for me, it was very both representative, symbolic, and important in terms of the overall care that I received. And it was simply a caregiver holding my hand. Holding my hand. I'm a 77-year-old man, and this was a woman who was probably, 40 years younger than I was at least, just holding my hand. And for me, that was critical care. That was critical care. That's what I'm going to leave you with.
That's an awesome visualization, and it says a lot. But Abby, what would you like to leave us with?
I think just gratitude. I think I've been expressing it throughout, but gratitude for obviously the treatment of my dad, but much bigger than that, to the whole community for what you're doing, for what you sign up for because you believe in this bigger purpose, and then what you give back. And I know it takes a lot, but give back to all of us, not just your patients.
Thank you both so much for all of your time. Vicki, do you have anything additional that you wanted to ask?
I do not. Again, just amazing time together.
Well, we are grateful for both of you coming and spending some time with us today. And thank you all for listening. Subscribe to Voices in Nursing on Apple, Google, or Spotify platforms, or wherever podcasts are found. And we welcome feedback at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's certification, offering specialty, subspecialty, or advanced practice board certification, with information available at www.aacn.org/get certification.